Scans are special. It's your meeting with your baby. Hearing his heartbeat on that computer and watching him grow was very, very emotional indeed. Now let's answer some quick questions like, what is an ultrasound scan? Is it painful? Does it cause any harm to the baby? How many scans are too many? So an ultrasound scan is a test that uses high frequency sound waves to capture live images from the inside of your body. It's also known as sonography. An ultrasound does not have any X-ray radiation. Is it painful? It can be somewhat uncomfortable, but it wasn't painful to me. They just put a cold gel on your tummy and then a scanner or a transducer with a smooth edge that feels more like a rolling ball is placed on your tummy by the doctor or the sonographer who checks you. Let me give you a tip. I wore a short free-flowing dress so that all I had to do was pull it up during the scans. Now, is it necessary? I feel that it's important because it shows you or makes you hear the baby's heartbeat. It tells you whether you're pregnant with one baby or twins or more. It detects an ectopic pregnancy where the embryo implants outside the womb, usually in the fallopian tube. It detects a molar pregnancy in which there's an abnormal placenta and usually no baby. It finds out the cause of bleeding, if you might be having any. And it also tells you the abnormalities in the baby's growth. Now, I believe these are really important things. Now, how many ultrasounds are done during pregnancy? I believe personally about 4 ultrasounds. Those are the really important ones. But there are many factors that depend on how many ultrasounds you might be suggested to do by your doctor. It depends on your age, complications, previous history of miscarriages. The first scan is the dating scan. It's done between 6 to 9 weeks to confirm your pregnancy. It tells you things like if you have ectopic pregnancy, the number of babies in the womb, heartbeat of the baby, what's your EDD, that means estimated due date. The second scan is the NT scan or the Nuchal Translucency scan. It's done in the first trimester between 11 to 13 weeks to rule out the Down syndrome. So what they do in the scan is measure the thickness of the area behind the baby's neck to detect any chromosomal abnormalities, especially Down syndrome. This is done with a combination of blood tests known as the double marker test. The third scan is the Anomaly Scan, which is done between 18 to 20 weeks. It's also known as the mid-pregnancy scan. Anomaly scan is the most important investigation, especially in India, since abortions are allowed only up to 20 weeks. It tells you about any structural abnormalities of the baby. The baby is looked at in detail, checking the heart, face, bones, spinal cord, brain, and abdomen. The fourth scan is the growth scan, or the fetal well-being scan, done between 28 to 32 weeks. This scan shows the growth pattern of your baby. The fifth scan is also a growth scan, done between 36 to 40 weeks. This is the final scan that assesses your baby's position and weight. It also checks the fluid around the baby and if the cord is around his neck. You will need more scans if you've previously given birth to a small baby, you're above 35 years of age, you've conceived after having treatments for infertility, you're carrying twins or more, you have complications such as diabetes or high blood pressure. If your scan reports show anything unusual, your doctor will recommend you to take further tests such as the NIPT test, which is the non-invasive prenatal testing, or diagnostic tests such as CVS or amniocentesis. I have taken the NIPT and amniocentesis and I will talk about these tests in the further videos. Our babies are special and scans allow us to make sure that they're growing in a healthy environment and in a safe environment. Lots of love to you, happy pregnancy to you, and happy Motherhood Chronicles to you.